Good afternoon po everyone. Welcome po to our 132nd episode of the Stop COVID Deaths webinar series. Very special webinar for this week, and wherever you are, in whichever part of the world you are, thank you for being part of our credible online community. And to all those who've just discovered us for today, welcome po, and hope you learn a lot of things from our panel of experts for today's webinar. Today, as mentioned, very special episode because we have partnered up with the Asian Development Bank. This is through their Technical Assistance 6767, which organizes the Secure Webinar Series as a platform to document, disseminate, and promote innovative approaches and best practices for COVID-19 vaccination among Southeast Asian developing member countries. It serves as a venue for knowledge and information exchange among governments, development partners, civil society, organization networks, and other key stakeholders. And for today's topic, we'll be talking about climate change, which is said to be the greatest threat to public health. The threat is described as existential, as there are concerns that survival of humanity itself hangs in the balance. There are multiple and complex pathways for negative impacts on health, from food security to injuries from disasters and catastrophic events. Slow onset events such as rising sea levels will have serious consequences on archipelagos such as the Philippines and Indonesia. And meanwhile, abrupt changes brought about by disasters, emergencies, and pandemics can threaten health security overnight. So the question that we need to ask ourselves, are we preparing ourselves enough? How do we prepare for these scenarios? And what is the role of the health sector in climate action? I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday, and looking forward always to our Fridays because I get to share hosting duties with our adjunct research faculty, also the co-chair of the National Panel of Technical Experts of the Philippine Climate Change Commission, and very new po ito, newly appointed co-editor and regional advisor for Asia and the Pacific of the oldest medical journal, which is the British Medical Journal po, Dr. Susie Pineda Mercado. Dr. Susie?
Hi, good afternoon, Raymond, and I'd like to greet all of those who are with us on the Zoom, those of you who are watching on the playback. We are live streaming on TVUP YouTube channel, as well as the UP System Facebook page, TVUP Facebook page, Stop COVID Deaths Facebook page, and of course, we are also on mainstream television, TVUP Signal TV channel 101. In this episode of Stop COVID Deaths, we deviate a little from the usual format and welcome this partnership with the Asian Development Bank. And we will be delivering this webinar in English, as it seems we are going to be sharing this to a larger international audience. And so we're getting ready for the nosebleed. Okay ba yun, Raymond? Anyway, all right. We're going to have a more formal run of show. We will open with a message from the ADB Principal Health Specialist for Southeast Asian Development, Dr. Eduardo Banson, or Dodo Banson, who oversees the work of the bank in 11 countries and has prioritized climate and health in its work plan. As Raymond has mentioned, I will be the main presenter with the reaction to be given by Dr. Ted Herbosa, Chair of the Department of Emergency Medicine at the UP Philippine General Hospital. Closing remarks will be delivered by Stella Jose from the Philippine General Hospital. So over to you, Raymond.
Thank you, Dr. Susie. Very powerhouse po. Line up, but sit tight and relax po for an afternoon of new learnings and realizations. And you will have noticed in our opening billboard, we have transitioned to broader discussions on how the pandemic has affected health outcomes beyond COVID-19. That's why we have maintained the title Stop COVID Deaths, but COVID has expanded as an acronym na po in our discussions. And climate change definitely fits under this umbrella, most especially here in the Philippines, where it is said that we are one of the most disaster-prone countries. So we are seeing increased frequencies and more intense severity of typhoons, storm surges, landslides, droughts, resource shortages, and even rates of sea level rise, which impact on our health security. So to open our webinar, let us welcome our opening remarks speaker. He champions universal health coverage and has long provided technical support to countries in Asia and the Pacific in pursuit of UHC. He is the Principal Health Specialist in the Southeast Asian Regional Development of the Asian Development Bank. And prior to joining the ADB in 2014, he was the President and Chief Executive Officer of the Philippine Health Insurance Corporation, or PhilHealth, World Health Organization Regional Advisor for Health Financing for the Eastern Mediterranean region, and World Health Organization Health Economist in Bangladesh, as well as World Bank Senior Health Specialist for East Asia and the Pacific region. Please welcome to our webinar, Dr. Eduardo Banson. Dr. Dodo.
Thanks, Raymond, and thanks, Lucy. And really great to be part of for this partnership to happen between ADB and UP on this. I'll probably step back a bit. The Asian Development Bank is a regional bank. It's actually owned by the member countries, including the Philippines. Started in 1966, and its vision was to make it was an Asian Pacific was free of poverty. Recently, we've basically changed that, and we're envisioning now, because we see Asia really grow, that we're now looking at an Asia that's prosperous, inclusive, sustainable, and resilient. As we were changing this, something happened. A global emergency, a global health emergency called COVID-19. And we saw the impact of how it affected the economy. The Philippines, 9.6% contraction. So imagine 1 out of 10%, nearly 10% of the economy contracted in 2010. And we saw this across Southeast Asia. So in a sense, that's the COVID-19 is a health emergency, but it's also emphasized the point that it's a development agency. It's a development emergency. It's a economic crisis. And as we move on from COVID-19, as we recover from COVID-19, I think it's highlight the fact that we need to address a lot of these other potential emergencies, because these will not just become health emergencies, but also economic emergencies. And one of them, of course, probably the most important, as I said earlier, is climate change. We're now seeing how climate change have impact adversely health, that we need to take action, not just to mitigate it or reduce the carbon emissions or what we call climate change mitigation, but we also need to strengthen health system, because that we now see that it's not just communicable disease, that it's not just a story of how climate change will lead to more dengue and malaria, but it's actually seeing mental health has become an issue with climate change, communicable disease. Extreme heat has led to problems with cardiac events. Pollution, air pollution is a problem, of course, for cardiac and respiratory. So it's a much more, it's really the adverse event on health is such that strengthening of health system is a climate change adaptation action. And so for this reason, we want to work with experts in the health systems, including UP, to see how we could basically work on strengthening health systems so that we could help countries adapt to the adverse events of climate change. We're also seeing that unfortunately the health sector is also one of the biggest carbon gas emitters. The estimates globally is about 4 to 5% of what we emit is coming from the health sector. All you have to do is go around the hospitals and you see it's 24-hour aircon operations. There's a wastewater management. You don't see a lot of this mitigating actions as part of the infrastructure of hospitals. There's a lot of what we call non-civil work actions, like reducing the air conditioning to 24 degrees. That has not been adopted. Awareness on how to mitigate the impact of climate change is not really part of health training. I don't think the graduates of UP fully understand what climate change is. So we also see an opportunity for us to make the health sector mitigate, reduce its role in causing climate change. And so for this reason, we look forward for this webinar, as I was telling Susie and earlier. We see this as a start of hopefully more discussions, hopefully more climate change, but other topics as well. And with ADB, and by the way, we're also committed to finance at least $100 billion worth of investments up to 2030 that's address climate change, not just in health, but in transport, in power plants, and all of that. So we look forward for more collaboration in the future on health and climate change. So thanks, Lucy. Thanks, Raymond. And by the way, welcome everyone to the webinar.
Thank you so much, Dr. Dodo. That was Dr. Eduardo Banson, who is Principal Health Specialist of the Southeast Asian Department of the Asian Development Bank. Dr. Susie?
Yeah, thank you so much, Dodo, for putting putting our webinar in context, and we truly appreciate the partnership that we are developing and hope that we'll be able to help more people as we work together. So Raymond, I think we're gonna listen to what ordinary people think about climate change.
That's true. That's true. So oftentimes, as with our previous webinars, we set our discussion into context, and we use what we call the person on the street interviews. It's a short video produced by the TVUP team just to gauge the pulse of the common folks on the street for our topic for today. And the question that we posed: what is your understanding of climate change, and how do you think climate change will affect your health? Please watch this.
Para sa akin, yung climate change, ito yung pagbabago dun sa klima at panahon na meron sa bansa, dulot ng pagbabago din sa teknolohiya at yung gamit sa industrializations.
When I think of climate change, I think of global warming. I think those are very intrinsically interlinked.
Climate change is an effect of the depleting ozone layer. So, ayun, wala na tayong protection sa UV rays. So, nagiging parang nagiging unpredictable yung weather natin.
In the way I see it is the drastic change in our temperature and also our weather patterns. And I think that the human activities are the main factor as to why we are experiencing this right now.
For me, nagkakaroon tayo ng climate change dahil marami ring mga umuusbong na mga industrial companies na yung kanilang mga products or yung ine-emit na mga wastes ay nakakaapekto sa klima or dun sa environment natin in general. Kaya nagkakaroon tayo ng pabugso-bugso or paiba-ibang sitwasyon sa ating klima.
So ibig sabihin nito, habang umiinit at painit ng painit ang ating environment, mas tumatagal ang buhay ng mga bacteria and viruses that can potentially affect our health, not only as humans but also the animals.
Ako, as someone na medyo sakitin na lately because of the pandemic, yung climate change ay nakakaapekto dun sa productivity ng tao sa pang-araw-araw dahil minsan kahit na panatiliin nating ligtas yung mga kinakain natin or kahit na uminom tayo ng mga vitamins para manatiling maging maayos yung ating resistensya, naapektuhan yung productivity ko bilang isang manggagawa at bilang isang tao dahil dun sa pabago-bagong klima na meron sa bansa.
Personally, to my health, mahirap mag-exercise kasi polluted yung air. Pero thankfully dito sa Diliman, we have green spaces, so conducive siya for working out and having physical activities.
The simplest way na pwede nating maiwasan ang pagkalala ng ating climate change is for us to recalibrate our actions, our decisions in life.
Para sa akin, siguro kailangan mag-invest ng government sa pagpapaunlad ng ating ecological resources kasi nakikita ko kasi na ang development ini-invest ng mga tao sa buildings, infrastructures, pero sa klase ng klima or bansa na meron tayo, I think kailangang equally important din yung pag-invest sa ecological and environmental resources natin.
Okay, thank you so much, TVUP. Always a pleasure to hear what people on the ground are thinking, and we really appreciate all of these POTS interviews being produced by the TVUP team. A little bit of housekeeping for all those who are asking. Certificates of attendance will be provided to those who have watched at least 50% of the webinar duration. Those who are asking for their webinar certificates for the previous 131 webinars, if you have any questions, please feel free to email us at stopcoviddeaths@up.edu.ph. Before we proceed with the topic at hand for our webinar, wherein we'll be learning climate change and the impact on post-COVID-19 health security, just wanted to tell everyone that we'll be having a standard panel discussion format after the speaker, and wherein we'll have a main speaker and a reactor. Obviously, after both speakers have presented, we'll have a panel discussion followed by a Q&A session. We hopefully will have ADB Principal Health Specialist Dr. Banson join that if he is available. But before we delve into the webinar, we know everyone is very, very excited and looking forward to this one each and every week. So we have now the cute introduction for our fun quiz segment.
Hello?
Hello!
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Yes, we have this little bit of animation just to engage with the audience. Hopefully that brought a smile to your faces, especially for those who are watching us internationally. For those who are logging in via YouTube or via Facebook, you could participate in our fun quiz by opening up your web browsers, typing slido.com and entering the code when prompted 6510096. That's 6510096 for you to be able to participate in our fun quiz. For today's fun quiz, we have 3 questions on the topic at hand. First question, and I hope everyone in the Zoom is able to see it. First question: to avert the harmful effects of global warming, surface temperature increase should not exceed option A, 1.5 degrees Celsius, option B, 4 degrees Celsius, or option C, 10 degrees Celsius. Would like to greet those who have really indicated they're being avid viewers of our webinar po. We'd like to greet those who are joining us from Rizal, from Bataan, those from Cavite, Loma de Gato in Marilao, Bulacan. Thank you so much. From RPHS Annex 1 in Antipolo, our Taguig City University Medic Clinic, welcome po. From the PGH, the Philippine General Hospital and the wards therein, thank you so much for joining us. Those who are joining us from Los Baños, Laguna, we have international speakers also, which I will greet later on. Locally, we have the Southern Philippines Medical Center in Davao, the Research Institute for Tropical Medicine in Alabang, the Clinical Lab Department. Thank you so much for joining us here. Amang Rodriguez Memorial Medical Center Public Health Unit, Health Education and Promotion Office in Marikina City. Those from the National Teachers College as well, from the province of Camarines Sur, welcome. Development Academy of the Philippines Graduate School, also very, very much welcome. And all those who are joining us, Rizal System Health Services, University of Rizal Health System Health Services Unit, welcome, and we hope you'll be able to enjoy our webinar from Iloilo City and from Santa Rosa CHO1 COVID Lab. For question number 2, the top global health security risks include option A, new infections, option B, increase in travel and trade, option C, drug resistance, option D, bioterrorism, or option E, all of the above. Okay? In terms of our registrants, we have registrants from the Department of Health of the Philippines, DTRC in Dagupan, Pangasinan. Also those joining us from the Department of Environment and Natural Resources, Ecosystems Research and Development Bureau, Los Baños, Laguna. From the University of the Philippines, Visayas University Library in Miagao, Iloilo. Thank you so much. From the Dr. Jose Rizal Memorial Hospital in Dapitan City, and from Tombok Salayog Hospital, Tacurong City in Sultan Kudarat. And finally, for our third and final question, approaches to pandemic preparedness and lessons learned from COVID-19 will be the same strategies for climate action and health. Is that true or is that false? So just 2 options for you to be able to choose from. We'd like to greet those not just from the House of Representatives of the Philippines as well as from the University of Santo Tomas Hospital, but internationally we have those our colleagues, set of ADB consultants from Vientiane in Laos, those from the Asian Development Bank base in Bangkok, Thailand, welcome, as well as in the Asian Development Bank office in Hanoi, Vietnam. We have another one, Asian Development Bank, but based in Vancouver, British Columbia in Canada. There are those who are joining us from the Chonin Hospital in Taipei City in Taiwan, Rejang Ear, Nose and Throat Specialist Clinic in Cebu, Sarawak, Malaysia, from Saigon International College, Ho Chi Minh City in Vietnam, University of Hail, Saudi Arabia, Lunichi Ali University of Blida II, Algeria, from Hamad Medical Corporation in Doha, Qatar, the University of the Philippines Nursing Alumni Association International Incorporated in Edison, in New Jersey, in the United States. And finally, from the United Kingdom, East Kent Hospitals University, NHS Trust, Tunbridge Wells in England. So thank you so much, and we hope everyone has had the time to really review their answers. We will be leaving our Zoom poll and Slido open as we continue our program. Our speakers will comment on answers later on during our panel discussion. So I know everyone very, very excited to get this discussion underway. So let's introduce our main speaker for this webinar. Obviously, I'm a fan favorite, and rightfully so. And she's a renowned public health communication expert, as mentioned. But did you know she also holds a position of Director of Food Systems and Resiliency of the Hawaii Public Health Institute in Honolulu, Hawaii. She is our adjunct research faculty at the National Telehealth Center at the University of the Philippines Manila National Institutes of Health, and the co-chair of the National Panel of Technical Experts of the Philippines Climate Change Commission. Recently, she has been appointed as co-editor and regional advisor for Asia and the Pacific of the British Medical Journal. Please give a warm virtual welcome to my partner, Dr. Susie Penada Mercado. Dr. Susie.
Thank you so much. Thank you so much, Raymond, and everyone is here in the
Ayan,
webinar.
all the hearts and all the applauses, Dr. Susie, even before you
Thank so
speak.
much. Yeah, thank you. So, there's no course for climate change and health. And so when I was asked to join the National Panel of Technical Experts, I had to study. And but for this webinar, I had to study even more. So I want to give you the latest information that I can share with you. And so I'm going to ask TVUP to please put up my slides. Thank you. Okay. The title of my presentation is Climate Change and Post-COVID-19 Health Security. And what we're going to do is I'm going to talk a little bit about climate change. Then I'll talk about health security, and then we'll talk about what we've learned from COVID-19 and see how useful that would be moving forward. So as a disclosure, I have no interaction or research with any commercial entity involved in products or services for COVID-19 or climate action. Next slide, please. All right. In 1998, Norwegian scientists were able to retrieve the influenza virus H1N1 from bodies of 6 dead frozen soldiers who died during the 1918 pandemic. So from 1918 to 1998, that's about 80 years. 8 years after, and these soldiers were about 800 miles away from the North Pole. So they were frozen. But even if they were frozen, the virus and viral fragments were still found in their bodies. And this is one of the pieces of information that helped scientists characterize what was the cause of the pandemic of 1917, 1918. In that pandemic, 500 million people were infected and 50 million people died. For COVID-19, we have more people infected, 671 million, but less deaths, about 6.8 million deaths. Okay, so I think science has evolved to a point where we were able to quickly develop a vaccine for COVID, for a pandemic, unlike what happened in Norway. But the reason I'm showing you this slide is because it just shows that these viruses can thrive in extreme temperatures. And so, next slide, please. I think the question is, what happens if more icebergs melt? I think you've seen this. You've seen pictures of polar bears standing on a little chunk of ice. We know that the icebergs or the ice caps of the world are slowly melting. We have glaciers that are melting and moving. And one wonders what other viruses may be trapped in the ice that we could be possibly exposed to. But let's talk a little bit more about, next slide please, about what we're seeing from climate change. Okay, so as the ice caps melt, the oceans become warmer because the earth is becoming hotter. And when you have a storm, the storm will want to get more water below the surface because it wants cooler water in order to move. So this is why the storms are becoming stronger. It's because the oceans are warmer. Next slide, please. Now, with severe storms or stronger storms and typhoons, in our parts of the world, we see flooding. And recently there have been floods. Oh, even in Northern Europe, which, we never had floods there. All my life, we have never seen floods in Mindanao. We're seeing floods in Mindanao, and which is south of the Philippines. And so this has an impact on plant life, on food. It has an impact on human habitat, communities. Next slide, please. Of course, you have heard that because of the change in the temperature, which is the earth is becoming warmer, this also has an effect on mosquitoes. So, for example, northern Japan never had dengue, but about 15 years ago, they started seeing the Aedes aegypti in northern Japan. This used to be very tropical, only in the very hot areas of the world. So there are changes because of the vectors. Next slide, please. And little talked about, but a huge problem is the effect of flooding when it interacts with the problem of poor sanitation. This is in Bangkok, Thailand. And as you can see, this is a scene that you could also see in the Philippines, where you have open dumping, you don't have good sanitation. If you're hit by a flood, then you're creating very complex situations that create higher risks for health. Next slide, please. Okay, now aside from the floods that come from stronger storms, many places see extreme heat and drought. And in fact, in many of the developed countries, it's not just heat and drought, it's also forest fires, which I think last year we saw, huge fire in Australia. And here in the United States, there are also fires in the West Coast. And in Southeast Asia, there are also fires in Indonesia. So these events are so interconnected and so disruptive that they can impact on many things, including food. Next slide, please. And the prices of food, for example. Now, I live in Hawaii, which is the most geographically isolated place on Earth. This has been measured, and you would think that Hawaii, which is considered a paradise, produces its own food. No, it imports 90% of its food. And this is the situation in the 22 Pacific Island countries as well. Food is not produced on the islands. What has happened is that globalization and the globalization of trade has created interdependence for food systems, meaning we have to produce food that we can export so that we can import food from other places. And one of the import-dependent products of the Philippines is rice, which was many years ago. We were self-sufficient in rice. In fact, we exported the scientists who learned how to grow rice in Thailand and in Vietnam. And now we are dependent on imported rice. And when you have import dependence, you are therefore hostage in terms of prices of food, mainly because transportation costs can go up if the price of fuel goes up, or in the case of the pandemic, when there were people in the transport sector who would get sick. There would not be enough human resources to carry food to trucks or to sea vessels in order to deliver this to the places where they were needed. So this import dependence or interdependence on food is really a big challenge for us. And it is really a, what should I say, a wake-up call for everyone to start looking at how can we be more food self-sufficient. I don't think anyone can become completely food self-sufficient. No country can be completely food self-sufficient. However, it can be, import dependence can be minimized. Otherwise, it might lead to economic problems and an economic crisis. So next slide, please. So, and where you have an economic crisis and when people are struggling with high prices, unemployment, disasters, you're really breeding political unrest. And as we know now, we are in fact facing a conflict in Europe, which maybe it seems far away from us right now. But if you look at the history of World War II, it took a couple of years before what was happening in Europe escalated and became a problem globally. So the war in Ukraine is relatively fresh, but we can see that there is escalation, and that war has an impact also on warming of the planet, because you can see all the smoke here, and we realize that this is not helpful in terms of the situation for climate change. Next slide, please. All right, so let's talk about why the polar caps are melting, and what's the reason why we are not able to slow down climate change. All right. So modern life as we know it is based on a form of energy that is derived from fossil fuels. Many, many years ago, we were using wood and charcoal, and then later shifted to coal, beginning the iron industry in the 1700s. By the 1900s, coal was the primary fuel, taking over all forms of energy. Now, what's a fossil fuel? Fossil fuel is a class of materials formed from dead organisms that sunk below the surface of the earth millions of years ago. Now, there are many different types of fossil fuels, such as crude oil, natural gas, and coal. But 80% of carbon dioxide in the world, which is carbon dioxide is the one that's making our earth warm, right? 80% of that comes from greenhouse gases from the burning of fossil fuels. And the Philippines still has coal-fired plants. In fact, they should have been phased out completely. I don't know what has happened, and that would be a good point of discussion. But currently, the greatest emitter of fossil fuels in the world is China. And unless the bigger countries bring down their emissions, we all suffer. So the Philippines does not contribute very much to greenhouse gases. But we have pledged to halve our greenhouse gas emissions, which I think should not have been the case, but that's another webinar altogether. The bigger countries are the ones that have to cut down on their use of fossil fuels. So, and that's really very contentious. Next slide, please. So as you can see in this slide, as carbon dioxide, look at that graph, right? The black line is the carbon dioxide concentration. And what you're seeing, the blue and the red, are your temperatures. So the more carbon dioxide you have in the air, which is also what you get from air pollution, right? Carbon dioxide, the hotter the atmosphere gets. And so bringing down the level of carbon dioxide emissions is really critical to reducing surface temperature of the earth. Next slide, please. And here we can see, right, when, and this was an example from 2015, India and Pakistan had 49 degrees centigrade through a heat wave. And from that heat wave, they had 4 to 5,000 fatalities. 4 to 5,000 people died because of that increase in temperature. You can see was about more than 2%. Okay, 2 degrees. Okay, so what we see here is that as we progress through time, we're seeing more of these heat waves. And the problem with the heat wave is that people don't die right away. It's not like it gets hot and everybody collapses. That's not how it is. What happens is you will have to calculate for excess mortality, particularly among the elderly, maybe a month after the heat wave. And so maybe 10, 15 years ago, there were heat waves in Spain and in China. And the only way you will determine how much it has killed people would be to do a calculation of excess mortality, maybe a month later. And if we don't do that, we have no idea how many people are dying because of extreme heat. So this is a new form of surveillance that has to be done if we want to understand the impact of heat on human health and on mortality. Next slide, please. All right. Now, if things are to continue as they are, temperatures would spike by as much as 4 degrees centigrade. And what we're aiming for, and this is one of the questions in our fun quiz, what we're aiming for is really just 1.5 degree increase, but by 2030. But currently, there are scientists who are saying we're not going to make it. We're not going to make it. We're going to have an increase of more than 1.5 degrees centigrade. And hopefully it's not 4 degrees centigrade, because that's a scenario only reptiles would be able to survive. Now, I'm married to a politician, and so my little joke is, honey, mabuti pa kayo, mabubuhay kayo. You guys are gonna survive, right? So it's a joke, but what we're saying is that there are certain types of living creatures that will not make it, including human beings. If we go to 4 degrees centigrade, only those cold-blooded creatures are going to survive. Next slide, please. Now, I'm not going to go into this in detail because you'll find this if you Google it. What is the impact of climate change on human health? I'll just read through it really quickly. Okay, so you have rising temperatures, extreme weather, rising sea levels, and increasing carbon dioxide levels, which we've talked about a little bit. And this can result in air pollution, which increases the risk for asthma and cardiovascular disease, changes in vector ecology such as malaria, dengue, encephalitis, hantavirus, Rift Valley fever, Lyme disease, chikungunya, and West Nile virus. Increasing allergens for respiratory allergies and asthma. Water quality impacts could result in cholera and other kinds of waterborne disease. Water and food supply impacts leading to malnutrition and diarrhea. Environmental degradation that can result in forced migration, civil conflict, and mental health impacts. Extreme heat causing heat-related illness and death, cardiovascular failure, and severe weather, which causes displacement, injuries, fatalities, mental health impacts. Next slide, please. Now, it's not like the world is not trying to do, the world's leaders are not trying to do anything about it. They are. And we have the UN Convention on Climate Change, which started in 2015. And the Philippines played a very important role in that in that conference. And this was where there was an agreement that we will not increase. We will work towards not reaching a 1.5 degree centigrade increase by 2030. Now, this is a rather old map because in 2020, the United States, as you can see here in red, pulled out of the convention. But then when Biden was elected as president, the US returned to the treaty. So most of the countries have ratified. That's in dark green, meaning it's part of their law. And light green means they have signed it, meaning there is an intention to make it part of their law. And when a country signs up for an international commitment, it is binding, or it is like a national law for them. Next slide, please. All right, so let's talk a little bit about strategic considerations for the Philippines. I've been talking about climate change in general, but let's talk about the Philippines. Next slide, please. So we are one of the overall natural hazard score highest raters. So you compare Philippines, Japan, Bangladesh, Myanmar, China, Indonesia, India, Vietnam, and Pakistan. We outdo them all, right? In terms of our hazard, our proneness to hazards, natural hazards. Next slide, please. And this includes superstorms, surges. Remember Haiyan? Next slide, please. Oops, next slide, please. Okay, and sea level rise in the Philippines is 3 times higher than that of the global index. We are really at high risk for rising sea levels. Remember, the melting of the polar caps, right, is not just warming the water, resulting in warmer water, but it is also increasing the amount of water in our oceans. And we are very prone to this, 3 times higher than the global index. Next slide, please. Now, let's add to this a couple of more figures, right? 70% of Filipinos live in proximity to a coastline. And I found this photo, I thought I'd share it with you, showing a coastline, what a coastline would look like. This is probably somewhere in a fishing area. The Philippines has the 4th longest coastline in the world, which is estimated at more than 36,000 kilometers. And our entire coastline is longer than that of the United States, which is a huge continent, right? North America is huge, huge. But we still have the longest coastline because as you go around the Philippines and you look around an island, right, all of that is considered coastline. So with rising sea level and 70% of Filipinos living in proximity to a coastline, the logic is that we have to move away from the coast, isn't it? Next slide, please. Now let's talk a little bit about some of our cities are beside the coastline, but we have rapid and unplanned urbanization impacting on 50% of the population, meaning our cities grow without a plan. And that's not good because that means there's no water, there's no sanitation, and people just start going too close to the city, overburdening the urban area. Now, 1 out of 6 Filipinos live in informal settlements and slums, and that is a huge risk factor for anything, for floods, for infections, for heat, for any kind of change coming from climate. Next slide, please. We are also a nation of seafarers. So in this webinar, we talked about the strain of SARS-CoV-2 that spread in March 2020 was from India. It was not from China. It was from India through the Dream Princess liner that docked in Yokohama, Japan, where our Filipino sea workers were not allowed to leave the ship. So the Filipino seafarers are the largest group in the world. And this means there's mobility, there is exposure, possible exposure, and a risk for Filipinos who are in this line of work. Next slide, please. Okay, let's talk a little bit about the situation in the Philippines in terms of comorbidities and infections. And when people looked at COVID-19, they said, oh, it was about an infection. Yes, it was about an infection, but those who were most affected by the infection were those with what we call comorbidities. And that means 25% of the population have hypertension, an increasing number of people with diabetes, and other non-communicable conditions that are not diagnosed or treated. And so people wonder why they were hit so hard by COVID-19. Well, it was because they had underlying comorbidities that they didn't know about. And so this is another concern for the Philippines. Next slide, please. Next slide, please. Okay. Now, I work for the National Panel of Technical Experts of the Climate Change Commission. And I just want to share that we have a People's Survival Fund, Republic Act 10174 in 2012, that allocates 1 billion pesos per year for climate action. To date, this fund is at 14.5 billion pesos, but it has only spent 150 million pesos. The project sites are in Lanuza, Surigao, Siargao, Camotes Islands in Cebu, Gerona, Tarlac, Sarangani, Kicharo, and Agusan del Norte. Now, look at the money available, 14.5 billion, but look at the total losses from climate-linked disasters, 2010 to 2020, is 515 billion. So don't ask me why the money is not being spent. That's for another webinar. But it's not as if it has not been recognized that investments are needed. Next slide, please. So we go to the last section of my presentation, which is the future of health security in the Philippines and the lessons from COVID-19. Next slide, please. So what do we mean by health security? Global public health security is defined as the activities required, both proactive and reactive, to minimize the danger and impact of acute public health events that endanger people's health across geographical regions and international boundaries. All right. So when we are talking about health security, we are referring to acute or immediate public health events that happen quickly, like a pandemic, like a disaster, these or like a war. Those are considered health security risks. Next slide, please. However, climate change brings on what we call SOEs, slow onset events, meaning these things are happening so slowly that we don't even notice. So increasing temperature, desertification, or parts of land where plants won't grow anymore, loss of biodiversity, land and forest degradation, glacial retreat, that's the melting of the icebergs, sea level rise, which we've talked about, and ocean acidification and salinization, which is saltwater intrusion into the groundwater that we drink. Ocean acidification comes from the sinking of carbon dioxide into the ocean from excess carbon dioxide. So next slide, please. So what do we need to do in public health? We have to have investments, substantive investments in public health for surveillance, laboratories, vaccine production, workforce development, and emergency management. I'll talk more about surveillance, laboratories, and workforce development. I'm sure Ted will talk a little bit more about emergency management. So we go to the next slide, please. All right, let's take a look at what our early constraints were in COVID-19. And, you know, we have only one biosafety level. We had only one biosafety level laboratory 3. That was at RITM. And I know we have folks from RITM who are watching this webinar. RITM at the start of the pandemic was in charge of testing. It was in charge of training. And it was also in charge of accreditation of laboratories in the country. Now, if you have a pandemic, how in heaven's name can one institution do all of that? And what happened in RITM was there was an outbreak. So people got sick. And so then testing really slowed down. This was when the Philippine Red Cross decided to set up laboratories because this was being done manually at RITM and we were not prepared. The country simply was not prepared for an outbreak. So slow testing, all right? We have been importing PPE from the get-go. And because of that, when there was a scramble for personal protective equipment, we were last online, right? We didn't have the money maybe to buy it. I'm not sure, but this resulted in death of health workers. And in the beginning, we made the serious mistake of allowing all hospitals to accept COVID patients. And for hospitals that are not geared up for infection control, then you would have outbreaks in hospitals. And that's where we had some of the deaths in the early part of the pandemic. Of course, these policies shifted as we went on, but when we started, this was the situation. Next slide, please. Now I'm going to talk very quickly about the global proliferation of high containment laboratories. And I think I talked about this in a previous webinar, but let's go to the next slide. Okay, so after 9/11, there's an article that talks about how after 9/11, many countries of the world started building more biosafety level 3 laboratories because of their concern about bioterrorism. China built 30, Taiwan 20, Finland 13, France 12, Germany had 97, India had 6, Indonesia 2, Ireland 31, Italy 4, Japan had 200, Malaysia 3, Mexico 4, Pakistan 2, the Philippines had 1, which was RITM. And that's what we had from the beginning. And after 9/11, we didn't do anything about that. Although Health Secretary Kwasi Romualdez wanted to have more biosafety level 3 laboratories with RITM as the mother laboratory. Russia had 84, Singapore 10, Sweden 40, Switzerland 26, Thailand 23, the UK 600, USA 1,643, and Vietnam had 2. Now, right after COVID-19, these numbers have all changed. So for example, India recently announced that it has more than 170 biosafety laboratories, level 3 post-pandemic. And I think in the Philippines, we still only have 2 or 3. RITM and the Philippine General Hospital in UP Manila, 3. So why do we need this? Let's go to the next slide. We need this in order to be able to test, to do testing, and to determine if there is a new virus or there are mutations happening that that could impact on our control measures. Okay, so without a good laboratory network and surveillance network, we are just hopping on one leg. Okay, we have to make this part of an overall plan for pandemic preparedness and put in the investments for it. So for example, why not have infectious disease hospitals and specialists in all provinces and start with something that we have never solved, which is tuberculosis. Now, I'm not saying build new hospitals. I'm not saying that. I'm saying you can take a district hospital and turn it into an infectious disease hospital and pay the people good wages, our health workers good wages to work towards elimination of tuberculosis, for example, which impacts on 1 million people a year. You know, we are so scared of COVID-19 and airborne, how it's airborne. My goodness, TB is also airborne. If you're in a movie house, I think the TB bacteria can live in the air for 8 hours or so. So why haven't we done this? So it is time for us to have infectious disease hospitals throughout the nation with very strong residency programs that will and you know, good pay for the people who are going to be working in these places, so that if there is a pandemic, everyone has a hospital to go to. Not everyone is going to try to crowd into PGH or wherever it is. No. Now, we don't have enough epidemiologists. I think there's a bill that is asking for the creation of a Philippine Centers for Disease Control. This has been long overdue. In fact, again, I'll say it. Health Secretary Kwasi Romualdez wanted to have this in 1998, the Philippine CDC. The money was there, the funding was available, there was space in Alabang, and there was also a place where we were going to put up a vaccine production site. But, you know, politics happens, and so we are where we are now in 2023, still without a Philippine CDC, meaning not having a body of technical experts who are highly skilled in surveillance. And I would say we need to bring that down to the local governments, that maybe per 1 million population, we need 10 epidemiologists. Do they need to be PhDs or masters in epidemiology? Absolutely not. Use the field epidemiology training program of the Department of Health, which has produced so many of our field epidemiologists who are doing good work on the ground. But there's not enough of them. Not enough of them. And you don't have to be a doctor to be an epidemiologist. Nurses, graduates of biology can go into epidemiology. It's not a full-time course. It is a in-service kind of a training. We have to purposely be better at surveillance, and we have to start looking at how we're going to manage all infections in this country, not just COVID-19. Next slide, please. All right. Now, at the height of the pandemic, some of us were thinking, you know what? The Quezon Institute, which used to be the Center for Tuberculosis, could actually be repurposed as the National Center for Pandemic Preparedness and Response. And around the world, repurposing of facilities is a usual thing to do. So if I recall properly, the City of Hope in California, which is like the #1 cancer center in North America, or if not in the world, right? It used to be their tuberculosis control center for the United States. And it converted into a center for cancer, particularly for leukemia. So how about we have a national center for pandemic preparedness and response? And we should produce and stockpile PPE so that we're not begging. We're not begging countries to give us PPE when we need it. I think this is something that we know, but I hope we don't forget that anytime, given the conditions of climate change, another pandemic could occur. Next slide, please. Poor air quality increases the risk for respiratory and cardiovascular disease. So in our thinking, air pollution and climate change are the same because they create poor air quality. And the Environmental Protection Agency of the US has found that exposure to increased concentrations of PM 2.5, particulate matter size 2.5, over a few hours can trigger cardiovascular and disease-related heart attacks and death. So I would say that one of the big problems of climate change is going to be respiratory disease. And that means our pulmonologists, our general practitioners have to get ready for this, because greenhouse gases collection has the same effect as air pollution. Next slide, please. All right. And therefore, our experience with wearing masks is going to be important. I think there will come times when we will have to wear a mask, not because of infection, but because of particulate matter in the air. Next slide, please. All right. We've learned that telehealth is extremely useful. And in fact, this webinar is a product of the National Telehealth Center of the National Institutes of Health of the University of the Philippines in Manila, because we quickly learned that we can use remote portals for teaching and learning. And so we have to invest on telehealth. And of course, the internet connection in the Philippines, right? That's a completely different story. But these are all interconnected, and telehealth is the way to go. Next slide, please. All right. Now, I mentioned earlier that we are a nation of seafarers, and that our seafarers are at high risk because when there is an outbreak on a ship, no country allows them to dock. So question is, can the Philippines host an international quarantine facility for sea vessels? Mainly because most of the seamen are Filipino. A place where you can get down from the ship, breathe fresh air, and be in an open space while you're being quarantined. It's just a thought, because it's useful for us, but it could be extremely useful for the world, and it could actually gain income for the country. So that's just a thought. Next slide, please. All right. What is the coastal defense for, let us say, health centers that are beside coastal areas? First of all, health centers should be moved away from the coast because of the high risk for sea level rise. But if you can't do that, the solution is really to plant mangrove trees. And you can see here in the upper part of the slide, the trajectory of the waves is lower when you have mangroves. And of course, when you have mangroves, you have more coral reefs, and you have more coral reefs, you have more fish. So reforestation of the coastal line, the 36,000 kilometer coastal line of the Philippines, is a good investment for the country because it helps on many aspects, okay? And you can see here where you don't have mangroves. And the thing is, people cut mangroves for ano yun? For cooking. No, you have to ban that. You have to grow the mangroves around all our islands. Okay, next slide, please. Finally, just a few more slides. There are architects called the Green Architects of the Philippines who have designed, let's say, a healthcare center, which this is a miniature, which you can see is elevated. So if it floods, the health center is not underwater. And it has a rainwater collecting system. So that if there's no water, you've collected water. You know that half of all primary care facilities in the Philippines do not have running water. Tell me how you're going to deliver a baby in that space if you don't have water. And also rainwater collecting is very, very important, even for our facilities. Next slide, please. And this is another view of a hospital, which, as you can see, is elevated. It has slopes, it even has a helipad, but it's made of light material. And so this is one of the ways that we can adapt in the health system. Next slide, please. And finally, this is a design of a permanent evacuation center. As you can see, it is elevated. So we should stop using our schools for evacuation centers. And in fact, we should have really huge, big quarantine facilities that are converted into dorms or whatever it is, so that if there's a pandemic, we're not trying to construct them, at a high cost. And this one, permanent evacuation centers, you can see is elevated. In this design, I wish I could show it to you. The bottom is a fish pond where you can raise tilapia. And there is a common cooking area, because one of the problems in evacuation centers is beside the bed is the what do you call it? The cooking range. So that you're in your evacuation center, you're inhaling the fumes from what you're cooking, no? So here they have a common cooking area and vertical gardening with aquaponics, meaning the fish are part of the system of growing the vegetables. Next slide, please. Okay, so I'm winding up. What are the priorities of the National Panel of Technical Experts of the Climate Change Commission? So these are flooding, increase in frequency and severity of tropical cyclones, extreme rainfall, wind patterns, coastal erosion, biodiversity loss, sea level rise, extreme drought, climate-influenced diseases, and temperature increases. This is such a huge range, a wide range of concerns that we're facing. Some of them are acute onset, like flooding, and some of them are slow onset events. I want you to remember that, SOE, slow onset events. We don't notice them, but they are slowly affecting our life. Next slide, please. Now, given all the things that I've said, why is it we don't seem to be acting as much as we should? And I showed you the state of the People's Survival Fund, which is unspent. It's about 14 billion, right? And what came to my mind was the boiling frog syndrome. They say that if you want to, to boil a frog, you have to put it in a pot of water with very low flame, and then slowly increase the flame so that the frog will not be able to jump out, because the frog doesn't notice that the heat is increasing. You're increasing it slowly. If you put a frog in a pot of boiling water, it'll jump out. So I think this is what's happening to us and what's happening to the world. It's happening so slowly. That's why I mentioned SOE, slow onset events. It's happening so slowly that unless you step back and look at what's happening to the world, I don't want to go to the next slide, please. Unless you step back, you don't realize that the earth is actually on fire in many places, or it's underwater in many places. And you think it's just something that happened to you today, not realizing how widespread it is. So I'd like to end there. I'd like to thank ADB and, of course, all my colleagues in TVUP for giving me this time and my overtime in my presentation. And I look forward to your questions. Thank you so much.
Don't worry about your overtime, partner. We're very, very grateful for your incredible presentation. You were able to really distill it to just a part of that very, very wide scope topic of climate change. And I really like the part about surveillance and laboratories, Dr. Susie. That part of it sometimes gets by the wayside. Maybe that's something that we can ask our colleagues from the ADB, how they can help out, not just for the Philippines, but for those in ASEAN po. Thank you so much, Dr. Susie. For our reactor, he's a familiar face to everyone on Stop COVID Deaths. But before we introduce him, I just like everyone, if you have any questions for today's Q&A session, please feel free to put them in the Q&A box here in Zoom. For those who are outside of the Zoom in YouTube and in Facebook, please put them in the comment section. We'll be choosing those. We have a team who is scanning those platforms, and we'll be choosing those questions that are interesting. So we encourage everyone to start typing in your questions in those channels po, and we hope one of those questions will be from you. Okay? For our reactor, he is one of the pillars for this webinar series when we first started broadcasting in April 2020. Currently, he's the chair of the Department of Emergency Medicine at the Philippine General Hospital and was senior advisor of the National Task Force Against COVID-19. Please welcome again to your screens, Dr. Ted Herbosa. Sir Ted.
Thank you, Raymond, and good
Yes, sir.
afternoon, everyone. And thank you to ADB, Dodo Vanson. Thank you very much for being a partner to Stop COVID Deaths, and to Susie for a wonderful, it's a difficult topic to actually discuss, but she was able to make a concise presentation. And I do hope that the National Technical Panel of Experts of the Climate Change Commission does have a disaster risk reduction expert, because that's my field of expertise, and my angle of looking at this will come from there. And I will start off with an animal, because Susie ended with an animal. So I'd like to start with an animal. And my screen actually, are you seeing my screen, Raymond?
Yes, sir.
Yeah.
I don't want to preempt people, but it starts with an R.
Yeah, it's a gray rhino. So Susie ended her talk with a frog, but I'll start to talk to you in terms of a reaction to climate change, disaster risk reduction, and everything that's happening now. On the issue of this, nakaharang yung aking chat box. I gotta remove it. It doesn't want to get removed. I can't see my presentation. There you go. There. So much making harang on me. There. Okay. There you go. So the picture here is Susie ended with that frog in boiling water. And I'll start with the gray rhino. And why is the gray rhino important to this particular reaction? Well, gray rhino, as quoted by Michelle Walker, is used to draw attention to the obvious risks that are neglected, and often because of their size and likelihood. The human vulnerability to cognitive biases within which lead to the denial of a threat. Then superficial and through rationalization to not do anything about it, and until the problem is diagnosed, leading to panic in the face of fear, anxiety, imminent crisis, towards finally taking action. And I think when you talk about climate change, this is basically what it is today. It's that gray rhino. And I think when I tried to figure it out, I go, when did scientists start to talk about climate change? So I Googled it. I found out they've been talking about climate change since 1896. It was a seminal paper by a Swedish scientist named Svante Arrhenius, and he first predicted the change in our atmospheric carbon dioxide levels would substantially alter the surface temperature of the Earth and cause that greenhouse effect. Can you imagine that? 1898, we weren't even an independent nation at that time. And the scientists already identified this particular thing that we talk about, this gray rhino. So I guess at that time, I think it was just considered like what, a black swan, something that could happen, but will probably be rare. So at that time in 1989, then in 1938, Guy Callendar connected carbon dioxide to increases in the Earth's atmosphere to global warming. So that's where the global warming started to talk about. And that's 1938, but we started to talk about it politically. I think I was already an adult when they started to talk and mention global warming. So in a recent paper published by Hendricks, I think Renzo Ginto was part of this paper. I looked at the authors, and Renzo Ginto was part of the. They talked about 3 Cs for climate change, and Susie covered all of that. We talk about the 3 Cs. What are the 3 Cs? Climate change was been fueled by COVID-19 and conflict, and we saw that today. I think what's very important is we've been talking about climate change, and we've been having issues about nutrition and food security because of climate change. So the slow onset events that Susie actually described. But then COVID-19 exposed all our weaknesses, right? And then you had the Russia-Ukraine conflict. And then today, now, the news yesterday was actually the EDCA sites, 4 EDCA sites for the Philippines, which I think will also fuel the South China Sea conflict. So obviously, COVID-19 exposes our climate change issues, and our conflict kind of magnifies that. Now, if you look at that, they're actually related to the 5 Fs. They call the 5 geopolitical influences that actually affect us because of climate change, and the 3 Cs. The 5 Fs are food, and we talk about food is about nutrition. Food is about agriculture. Food security is all about the changes in the soil, the changes in the microbes in the soil that leads to change in enzymatic reaction, the change in the weather leading to flooding, and then even changing the food or the plants that we cultivate to actually feed the population. So they call that the agroecological considerations for crops and the way weathers change. And very important to this is water source, either too little water, which Susie mentioned, which leads to drought and less food production, or floods, like what we have in the Philippines, that destroy hectares and hectares of cultivated land. Then there's the fodder, which is the food for the animals, the animal feed. There's the fertilizer concept as well. And and there's financing, and then fuel. So these are the 5 things that actually have geopolitical influence. So after COVID-19 and the conflict in Russia, we start with COVID-19, we got exposed to the changes in the supply chain. So suddenly our global supply chains were actually disrupted, whether it's food or whether it's something manufactured. And so that's something that talked about the global security. And then when Russia invaded Ukraine, our fuel prices skyrocketed. And the fuel prices were also the ones important to produce fertilizers. And our financing and our market started to crash. So I think all of these are interconnected, and then the drivers and the geopolitical influences actually lead to the outcomes that we're talking about that Susie's mentioned, which is basically very specific in health. Food security leads to undernutrition or overnutrition or whatever type of nutritional problem populations will have. So that affects health directly. And then there's environmental sustainability. We talk about the groundwater being infected by being infused with salt water. They also affect exactly our sources of water. And then, of course, leads to changes in livelihoods. Even this artificial shortage of onions and the high price of onions seem to be, I think, also related to climate change. So if you talk about animals again, basically, again, there's the traditional elephant in the room, but there's something different between the gray rhino and the elephant in the room. The elephant in the room is by definition something that nobody talks about and nobody does anything about, but it's just there in the room saying to you, and doing nothing is normal. But the gray rhino, which is climate change to us, no, it's not normal. We do have a choice in how to change it. So I think these are the two differences between the gray rhino and the elephant in the room. But lastly, there's also that field of mind, which is disaster risk reduction. We talk about black swan events, which are really mega disasters or the big one or whatever that we always prepare for. And this is again a metaphor that you should prepare for that black swan event. Which is the third animal that I'm going to describe. And they all kind of were used as a metaphor of how we can all benefit out of preparing for something that is unlikely, but it will actually happen and as a big event to us. So as an aside, they thought black swans didn't exist until they were discovered in Australia. So today we have a different meaning of black swans and black swan events. But as I said to you earlier, my field of expertise is not climate change adaptation. My field of expertise is disaster risk reduction. And many of the things Susie talked about in his last slides were actually disasters, or whether it's a flood, whether it's a drought, whether it's all of these other events that she described. Epidemics, outbreaks are actually focused on disaster. And I think we should all understand the interplay between climate change, which are usually just the gradual climate change effects, which are the slow onset events, mainly because of the changes of increased CO2, higher temperature, global warming, glacial melt. And of course, the ones for DRR, which is mainly risk natural disasters like brought about by earthquakes, volcanic eruptions, technological events. And in the middle, there's actually that interface. And I think this is the one that makes it clear. And I think, although in the diagram, the interface, I think climate change advocates and DRR are still not working together. And we learned how COVID-19 actually required the whole of government, the whole of society in the approach to actually solve a problem as big as COVID-19. And I give this message and reaction as well. And I think in the Philippines, because we're one of those countries that are prone to climate change effects and the DRR, disaster risk reduction, we need to work together and we need to combine all these resources together. So when you combine them in the middle, you actually have all those things that are considered disaster risks, but are also considered part of climate effects. So these are floods, windstorms, strong windstorms, heat illnesses, and excessive heat temperature that heats up the communities, and then landslides, slope instability because of excessive rains, and even droughts. So they're all together. We need to have this kind of global concept of putting them all together. And we're pushing the sustainable development goals. And I always shudder when people talk and say the Philippines is one of those disaster-prone countries or risked by climate change. It's very much our character of bahala na attitude, because I think we're in the ring of fire and other countries are also in the ring of fire, whether it's Japan, whether it's Korea, whether it's Taiwan, and whether it's Indonesia. All of them are in the ring of fire. But how come we're always number one? So I asked that question. I think we've not prepared for floods the same way Tokyo has prepared for floods. They created massive cisterns when they used to have floods in the 60s and 70s, massive floods. Now they don't have floods. Even Malaysia has done that. So I think it's wrong to always say, kasi we're disaster prone. Because we're disaster prone, we're always the affected. We're playing victim to ourselves. And I think that's something that we need to change. We need to be able to understand that some things can be done and many things can change the outcome of all this, whether it's disaster or climate change. We can actually do something about it. We can overcome these particular endeavors. And I think that's where the attitude and the message needs to change. So you can see we need to come up with the national agencies like DRR and CCA. We have that. We have the Climate Change Commission and we have the National Disaster Risk Reduction and Management Council. But are they working together? That's my next question. We have different hazards in the Philippines. Are we doing multi-hazard perspectives in planning our urban communities or even our rural communities and our coastal sites? When we are affected by a disaster, do we build back better? I'm sorry to hear the news in the other night. They still haven't fixed I think some people left the homes in Tacloban, the ones that were supposed to be for the renovation. It was just a mess. And then the importance of being able to understand the ecosystems and its relationship to the people. I think all of this is part of climate change. So I'll end there. I really think my message really after Susie's talk is really all about being able to work together, being able to change the framework. But yes, we can fix this. Yeah, it's a big rhino. It's a gray rhino, but we can actually fix this. Thank you very much, Raymond. Back to you, Raymond.
Thank you so much, Dr. Herbosa. I really like the optimistic attitude that you've shown, sir, and really look forward to answering the questions during our Q&A. You could see all of the applauses and the hearts and as the part of the reactions of our audience. Thank you so much. Before we ask our panelists, so we have Dr. Susie Mercado, Dr. Ted Herbosa, and Dr. Dodo Banson to open up their videos. We'd like to just take a very, very quick break for a special public service announcement today.
Maaari na bang magpabakuna ang mga batang 5 hanggang 11 taong gulang?
Oo, nagsimula ito noong Pebrero.
Nagpapakuna na ba kayo?
Oo, nagpapakuna na kami.
Ay, mga bata, magpapakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children age 5 and up. Please share this video clip with all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, I'll start the ball rolling and I'll choose to from our list of questions po, and this one comes all the way from Bangkok, Thailand, from Dr. Kanchit. He says, Dr. Susie, thank you for your nice presentation, and you told us very well for climate change and the impact to the Philippines and the world. What do you think are the mitigation and long-term plans that we should have?
Okay, for the Philippines, we actually committed. So let me explain first. Mitigation is where you try to reduce your greenhouse gas emissions. Okay, so that's mitigation. Adaptation is where you change your circumstances, your environment, so that you are less affected by climate change. So in terms of mitigation, which is reduction in greenhouse gas emissions, the Philippines is not a major contributor to greenhouse gas emissions. As I mentioned, the biggest polluter or source of carbon dioxide is China. And that's because they went into rapid industrialization. And so many of the smaller countries are really going to suffer and not go into industry, because now we're capping our use of fossil fuels. And what we really need to do is to develop alternative forms of energy. So this means, like for the Philippines, we have so much sunlight. We have a lot of wind, so we have to all move towards more sustainable, less fossil fuel use. And that doesn't come without an expense. It's also expensive. Here in the United States, electric cars are becoming very, very, very popular, and using smaller vehicles. But, it's going to take time before that becomes the norm because of the cost. So I think as the private sector begins to reduce the cost of vehicles that are not using gasoline, then you'll have more people using less. But that's not it. It's the factories, it's the source of electricity. So in terms of mitigation, really we are looking at the first world countries to reduce their use of fossil fuels. I don't know if that answered the question.
Yes, I think while waiting for a follow-up from Dr. Kanchit, but while we're waiting for that, that really opens up few more questions. Well, I'd like to we saw a question, but this is outside of the Zoom, that we'd like to pose to Dr. Dodo. And the question is, how is the ADB working to build or support the development of health infrastructure and services resilient to the impacts of climate change? Dr. Dodo.
Yes, thanks very much. Raymond, before I respond to that, just like to jump in a bit.
Go ahead, sir.
Yeah, can you hear me? I just want to jump in a bit, ACC. As I said earlier, the health sector accounts a lot for the carbon emissions, 5%. Of course, that's mostly outside the Philippines. But I think PGH should take on steps. So for example, the new Henry C. building sa College of Med, may solar panels yan, di ba? Of course, thanks to my medical class. So the idea of putting, for example, renewables all over PGH is something that can be explored. It's a hanging fruit. It's not that difficult to do and all that. Air conditioning is basically a problem. PGH is well designed, particularly sa baba. I said that's it's really designed na gumagamit ng hangin and all. But there's much more that you can do, including basically showing a model on how you could actually utilize better. We can reduce air conditioning and all that. Rainwater harvesting. These are just improve wastewater. These are all, in a sense, practices that can contribute. So, in a sense, if the hospital basically makes a commitment, and UP makes a commitment to reduce its carbon emissions, including measuring it, it's a university. Dapat when somebody is asked tomorrow, ilan ba yung carbon emission ng PGH, may sasagot yan. It's not something na hulaan pa. So, these are little things that can contribute. But of course, there's really lots of other things that needs to be done. The Philippines, I think, ang energy base natin is still coal. So there's really a need to shift. And one of the things ADB actually support is what they call energy transformation, ETM. We're helping countries shift away from power plants that are heavy in carbon emission into more into renewables. We also have programs. We also support what we call just transition. Because we also acknowledge that if you start shifting away, for example, from these power plants, jobs will be lost, people will be affected. So you want to make sure that people that are affected by the transition are also well taken care of. Now, on the adaptation side, so this is quite interesting because the approach of ADB is to support countries' view on what is adaptation. And I really love the presentation of Susie. Because she highlights a message that has to be highlighted by the health sector. That hindi lang po to infection. It's not just a very limited impact on health. And such that when you start talking about health sector climate change adaptation, very limited. So parang ang gagawin lang ng health sector minsan monitor more dengue, when really strengthening of health systems, given the wide range of health impact, is really climate change adaptation. And then resources should be provided the health sector because climate it's not just providing health services, actually helping people adapt to climate change. Finally, yung sinabi ni Ted, there's a lot of work on resilience have been done already by DDR people, disaster risk reduction, DRR people. And sometimes it's unfortunate that when terminologies are new, like climate change ang uso, parang kalimutan ng DRR. When dami na nagawa sa DRR. So I think we should just recognize that whenever we do things, we just build on what's been done before. And so we in ADB are supporting countries from Indonesia and looking at primary care and climate change resilience. In Thailand, in Philippines, we're trying to look into hospitals. And so hopefully we will provide both financing and technical assistance, but I think there's really a need particularly, and the last word, our understanding of the Philippines is there's going to be really huge investments in health infrastructure. There's no recognition na kulang ang primary care sa Pilipinas, sa facilities, kulang ang hospitals. So yesterday, PGH is supposed to launch its cancer center with PPP. Instead yata nagpasimuno niyan eh. So I hope that this new center na itatay sa PGH is climate resilient and also climate change mitigating. Diba? You should insist on this then. Huwag kayong papayag na kahit anong stock tuloy tayo. We understand that the Department of Health is going to invest lots of money in specialty hospitals. We understand that there's a push for LGUs to put primary care, more RHUs. So sana somebody should step in and say, pag gumawa kayo ng RHU, dapat resilient, dapat mitigating. Now, if these guidelines are not there, people will just end up putting up the same thing. So there's really a big opportunity now as the country is responding to the gaps that's been identified and acknowledged, that the new facility should be climate smart. Thank you.
Thank you, Dr. Dodo. That's a rejoinder from Dr. Ted.
Yeah, I just wanted to add to what Dodo said, because I'm married to an anesthesiologist, and I was so surprised that in the Society of Anesthesiologists, the American Society, they're talking about the effects of anesthesia gases on climate. It's actually a big effect, and they've been talking about this for a long time, and they're doing a lot of stuff on this in the US, but we're not. We just use scavengers. If you're pregnant, anesthesiologists will use a scavenger and expose the exhaust to the environment. Those are hydrofluorocarbons, actually go to the environment. So can you imagine, we will be building, so we don't have that yet. Stella Manalo is here. We still don't have that, some sort of trapping the air, because you have to trap the exhaust gas so that it doesn't go and emit in the environment. And the DOH is building, I'm in a technical working group for trauma centers, the specialty trauma centers. And this is not being talked about. I think we need to talk about this for all operating rooms that are going to be built, and the retrofitting for protecting the environment from the harmful anesthetic gases that actually hospitals use. So that's just an add-on to what the emphasis of Dodo about how hospitals are actually also contributing to this climate change.
Okay.
Next, Raymond.
Thank you, Dr. Ted. One other interesting question. Sorry, I don't think we have enough time, but I just wanted Dr. Susie to chime in on this, because this is very, I would say it's more of one of the more common questions that we encounter, but people tend to have differing opinions on this one. This one comes from Rizalina Cuanzon. The government is converting agricultural lands to housing or subdivisions. Don't you think that contributes to flooding and not of climate change?
Yeah, that's a very important point, because one of the problems I mentioned earlier is that we have unplanned urbanization and conversion, agricultural conversion, is because you get more money out of construction and housing, right? Instead of food production. Now, per se, that's not a bad thing, but it depends on where you're doing it. And therefore, it is very important that the Philippines has a land use policy, meaning we should say, this land is for agriculture, period. You cannot convert it. That's already classified as for agriculture. And these places are for housing, for human habitation. And this area, because it's always flooded, you cannot build back on it. So we have to have a kind of master plan for our land use, and not just ad hoc every time the local government changes. I agree. You see more housing development. Where are we going to get our food? Let's just think about this really. I here, my work in Hawaii here is to push for backyard gardening, which the Philippines does naturally, but we're not doing enough of it. So I think that's a very important point. We should not just be converting from agriculture to housing. We have to study the whole ecosystem of the area.
Susie, we still haven't passed the land use plan for the Philippines.
That's it. That's the problem.
Basic problem. Yeah.
Yeah, because the people who are elected own a lot of land.
Yeah, and they leave it up to the local chief executives. So they say it's part of autonomy, that let the governor or the local chief executive, the mayor, decide how the land in their locality will be used. But I think we need to use science how much should be for
Okay.
agriculture, how much should be for watershed areas, and how much should be for housing. In fact,
Absolutely.
I went to Malaysia when I worked there. They weren't using their land. They were building high rises for housing. They were building condominium apartments for housing. And I think that's a wise use because they keep the big agricultural lands still on agriculture. So that's a very
Yeah.
good thing. Tayo baliktad eh. We want to change the agricultural land into large mansions and houses of rich people. When all you need is really just a room and a space
Yeah.
in a building.
Yeah, I lived in Japan for 3 years, and you will see how sophisticated their agriculture is and how self-sufficient they are in rice. And that's what makes them also a very powerful country, no? When land is for agriculture, that's it. And people who are in farming and agriculture, they have a lot of money because they help their farmers. They put a value on food production. Here, we want to buy things. Food is a commodity, but that's another conversation. Just to say that, yeah, I agree. We need a national land use policy. You cannot leave that to LGUs. And if we do that, we will lose everything.
And
We
it
lose
must be ecosystem based. That
Yeah.
land plan must be ecosystem based
Correct.
solution. It's if it's a watershed area, you cannot build subdivision
Exactly.
there. So,
Exactly. Exactly.
Yeah. Okay. I think that's all of the time that we have, at least for our Q&A. Can we have on the screen our questions for the quiz? Thank you so much. So, Dr. Susie, first question: to avert the harmful effects of global warming, surface temperature increase should not exceed
1.5 degrees centigrade. That's the Paris Agreement.
based on
So,
the Paris Agreement.
it's a small increase, but it doesn't look like we're gonna get there. Doesn't look like we're gonna get there.
Oh wow, it's a little bit concerning, but hopefully we'll work towards that goal.
We have 7 years. We have 7 years. The world has 7 years to do this. But I
2030.
don't know.
we can do another lockdown, Susie, because when we locked down, the carbon emissions went down.
That's
Globally.
true, right? The environment benefited from, and
The
our
lockdown.
beaches and everything benefited from the lockdown.
No,
That's a joke, That's a joke. This is going
that's a joke, yeah,
international.
that's
Joking.
right.
Yeah.
How about our second question? For our second question, the top global health security risks include
All of the
all of the
above.
above: new infections, increase in travel, increase in trade, drug resistance, as well as bioterrorism. And for our final question, okay, approaches to pandemic preparedness and lessons learned from COVID will be the same strategies for climate action and health. Is this true or is this false?
True. And that was the latter half of my presentation, was that we've learned a lot from COVID-19. And what we've learned, we should not let go of that. We should keep it in place and do even more, because we really set up to have another what should I say, public health security problem. So yes, the answer to this is true.
Okay, thank you so much, Dr. Susie. So those who are keeping tabs on their correct answers po, no? So hopefully you were able to do that. At this point, I'd like to take this opportunity to invite everyone to answer the panel discussion poll that you are seeing in front of your screens. I'm giving Dr. Herbosa, Dr. Mercado, and Dr. Banson a minute or two to come up with their final messages to our audience as we go through these 5 questions. So the first question, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing our evaluation poll. Hopefully everyone, at least in the Zoom, will be able to join as we move on and ask for the parting words of our speakers. Let's start off with Dr. Ted Herbosa. Dr. Ted?
Well, I think what Susie has shown to us is that we must have ecosystem solutions and agro-geological solutions. I think those are the new terms wherein we look at the holistic approach to how we will do things. There was a question about a certain family name that does, subdivisions out of agricultural lands. If we're going to do farmlands as housing, which is because of our population, I think one of the things we should really consider is vertical farming, which they're trying to do in Japan and in Singapore. So I think, and rooftop gardening, rooftop gardens as well. So I think there are solutions. I think the solutions are there. We are there to solve the problems, but I hope the solutions do not come late. So it's indeed a very appropriate time that Susie has discussed this. And thank you to ADB also for giving the opportunity for TVUP to actually expand on this problem of climate change, human health, food security, and our ecological survival. Maraming salamat. Thank you.
Thank you. Thank you so much. That's Dr. Ted Herbosa, Chair of the Department of Emergency Medicine in the Philippine General Hospital. Okay, Dr. Susie?
I would like to give another kind of a message, which is probably just what should I say, a sub story to a continuing story to what I talked about. I think we have to encourage the development of epidemiologists, laboratory workers, our young people who focus on biotechnology and genetics. These are the fields that we need now. We need more of these scientists. And so I'd encourage you, instead of harping on all kinds of specializations for those who are in the health professions, this is where the action is. It's in epidemiology, biotechnology, laboratories, genetics. And so in order for the health sector to respond to climate change, we have to have a workforce that has a very strong capacity in those fields, because we are going to be prone, the world is going to be prone to more infections and pandemics and outbreaks, to disasters and to chemical events that could alter genetics. And so that's the future for us in the health sector. So thank you, everyone. I think that's just my little additional message for today.
Wonderful, wonderful. That was Dr. Susie Pineda Mercado, co-chair of the Philippines National Panel of Experts, of Technical Experts for Climate Change. And then finally, the Principal Health Specialist of the Southeast Asian Department of the Asian Development Bank, Dr. Dodo Banson.
Thanks very much. I think the presentations basically highlighted the impact of climate change and health. I think we have discussed also how the health sector should be able to contribute in the response to mitigate climate change, to help people adapt to climate change. Given that the audience there's a lot of people here from UP. Unfortunately, the Philippines really do not have that discussions happening on health and climate change. We haven't heard the health sector talk about, for example, the Philippines have not, in a sense, calculated how much is the health sector contributing. I don't think health and climate change is a topic being discussed in medical schools, nursing schools, or probably any of the professionals that are being trained by UP Manila. I think there has not been much research being done on what else can be done. Very interesting point I've heard recently is that if you actually put your health workers besides where they're supposed to be working, imagine a high-rise building, residential building inside the UP PGH campus, that would decrease climate change because people won't travel that much. So there are lots of fresh thinking happening globally. Tedros himself has said that this is the biggest threat to health in the world. So as the health campus, as the health university of the Philippines, of the UP, I hope, and so I mentioned still here, we hope that this discussion, this can trigger more teaching, research on health and climate change. And of course, we in the ADB will be happy to provide whatever support is needed to get this moving fast. Thanks, everyone.
Thank you. Thank you
Thanks,
so much.
Susie.
Thank you, Dr. Dodo. So can we have on the screen our evaluation results? Okay, so as you will note, at least 92% of all of those who participated, and there are a lot of them who participated in the evaluation call, really well received the presentation. It is a testament to a lot of the learnings and really the comprehensiveness of the discussion of such a wide topic, which obviously will not be able to tackle each and every part of it in just one webinar, but hopefully this serves as one of those jump off points for us to have more growing discussions in relation to climate change and health security. So we need to be able to make sure that the things that we are discussing have to be propagated for the ones that really have maybe less of an interest, and have this be more of a primary concern for everyone. And thank you again to Dr. Banson, Dr. Mercado, and Dr. Herbosa for a wonderful, wonderful webinar for today. But before we close, and to formally close our webinar, we have Dr. Stella Marie Jose, who is the Deputy Director at the Philippine General Hospital, to give her closing remarks.
Good afternoon, everyone. Our webinar was opened by Dr. Eduardo Banson of the Asian Development Bank, and we are thankful for the collaboration of ADB with TDUT. Dr. Susie Pineda gave an excellent lecture on climate change and the COVID-19 pandemic. And a short summary, she discussed the changes in temperature, and when the temperature became warmer, this resulted to floods which affected food security and even insect life. She said that extreme heat and drought had an impact on food, and this resulted to importation dependence and high prices of food, resulting to economic crisis, and this leads to unrest. She gave a very insightful discussion, and I also suggest that you go back to the recording so that you can review all that she said. And she said that the very important is the public health investment requirement, which is surveillance, the development of laboratories, vaccine production, workforce development, and emergency management. It was really a very insightful lecture by Dr. Susie Pineda. And from Dr. Teddy Herbosa, he mentioned the three factors in climate change: the driver, the geopolitical influences, and the outcomes. For the driver, the climate change interacting with COVID-19, and there is conflict with this, and the geopolitical influences like food, fodder, fertilizers, fuel, and the financial aspect, and the outcome, which is food security, diet, nutrition, and health, and environment, sustainability, and livelihood. He gave a very positive tone at the end of his lecture. And in a nutshell, he said that we should work together. We can do something. We can contribute to improve our situation. Thank you very much.
Okay, thank you so much, Dr. Stella Jose, for the closing remarks po, no? And really, it's near the top of the hour, and we really thank everyone for taking the time out. Just so everyone is aware, we have an exciting topic for next week. What is that, Dr. Susie?
Back to host ako ngayon. Okay, our topic next week, please join us. We are going to talk about COVID-19 bivalent vaccine boosters. When are we going to have this in the Philippines? So please join us. And for those of you who are interested and who have friends who want to join us, please join us next week. We will talk about vaccine boosters.
Okay,
For
thank
COVID.
you so much. Before we conclude our program, all of our webinars are archived for viewing at the TVUP YouTube channel for your convenience. You just go to www.youtube.com/TVUPPH for you to be able to enjoy all of our 131. After today, it's 132 webinars already. And also we have those shorts that you see in YouTube Shorts, especially for those who are very, very busy. Selected presentations are featured. And hopefully that's something that will be helpful for you and valuable for you as you just take the nuggets of wisdom, so to speak, from each of these short videos that we lovingly call SCD shorts. So that formally closes our webinar for the week. We look forward to your company again next Friday from 12 noon to 2 p.m. It's a day.
Together we can stop COVID deaths.
So keep safe, keep healthy, and see you online.